Giant suspended MRI scanner that moves in and out of an operating room has opened a new door for removing brain tumors.
Ed Yates reports on this unique system now installed at the Huntsman Cancer Hospital.
Well, there's a growth about the size of a walnut that I've seen, and it's no telling what it is.
Gene Hatch from Vernal has come to the Huntsman Cancer Hospital in Salt Lake to have a tumor removed from in between the two hemispheres of his brain. But this time, neurosurgeon Randy Jensen will do something very different in the operating room. Instead of removing what he can, then taking an MRI scan somewhere else in the days that follow to see what's left behind, Gene only has to go through the surgery once, not several times. That's because a 10-ton MRI suspended on specially designed overhead rails moves from an adjoining room directly into the OR to give the surgical team a view of what's left behind before the surgery ends.
It's a chance to check our work, and if there's any remaining tumor, that MRI can then be put into our intraoperative navigation system, and we can go back to work and take out the remaining tumor that normally we would have only found out the day following surgery.
With the incision still open, Gene stays on the operating table while the MRI takes multiple detailed pictures.
Since the MRI rolls in and out of this OR, all metal surgical instruments like these have to be moved out of the way of the magnet.
All the instruments in the room have to be counted before and after we're done working, because before the MRI can come in, there can be no metal objects within a radius around the operating room table.
In an adjoining control room, Dr. Jensen and his colleagues see immediately what they need to know. For Gene's surgery and the removal of his walnut-sized tumor?
Got it all, we're done.
And so is Gene. He'll still need chemo or radiation therapy as backup, but what could have been multiple surgeries ends up as one. The huge suspended MRI rolls back into its adjoining room, the incision is closed, and the patient goes back to his room. Ed Yates, KSL 5 News, Huntsman Cancer Institute.
Huntsman's MRI on rails is one of only 20 in the world, and it's the only one in the Intermountain West.